One leg.
I'm so grateful.
All right. One of the first things that you'll be able to do, okay, in the testing scenarios, is they're going to ask you if you want to look over your equipment. I suggest that you do look over your equipment. Always make sure, like I said, you've got what you want and that it is actually working. So take those few seconds, okay, to actually test and make sure that stuff is working and that you're not going to have a problem. Because if you get into your testing situation and one of your pieces of equipment isn't working because you didn't look it over, how much is that going to throw you off?
A lot.
A lot. All right, so make sure your stuff works. Stephanie can attest to this too. She went through the testing process, although it's very different from what it is now. But
Is it? Because you have to do National Registry, don't you?
yeah, and all the stuff has changed. All right. I'll tell you to make sure you have your stethoscope on your neck so you don't forget it or lose it. Make sure your spider straps are what you want. All right, like I said, for the state test, everything's verbal except for what? Taking your vital signs and actually doing your patient assessment, okay? But for in here, for right now, and for your county challenge, when you get done with this class, you go to your challenge, you have to do everything. All right? Okay, so all the scenarios are going to be the same right now. It's a trauma patient. They're unresponsive. That's it. Nothing else. So the very first thing I need to do, scene safe, proper PPE. Okay? I approach my patient. She is a trauma patient. It appears that I have one patient laying on her back. Patient appears to be unconscious at this time. Mechanism of injury is that my patient is a pedestrian struck, or whatever it may be. Okay? So you're going to come up, take your C-spine. Ma'am, can you hear me? She is unconscious. I'm going to perform a jaw thrust. I'm going to assess airway, breathing, and circulation. She appears to be breathing adequately. I am now going to pass C-spine to my partner, not you. Make sure you get that acknowledgement. My patient is unconscious, unresponsive. I need to request ALS. So that's your requesting your resources. All right? What is the next thing I need to do? I said she was breathing adequately. Her airway is patent. Remember that. What else? What's next? Not yet. Airway, breathing. Okay, so what do I need to do for breathing? I said her breathing appears to be adequate. Can you please place my patient on 15 liters non-rebreather oxygen? Done. I'm now going to check for a pulse. My pulses are present, strong, and equal. I'm going to expose my patient and assess for major bleeding. No blood, no blood, no blood, no blood, no blood. Okay. Oh my God.
Okay. Okay, sorry.
Are you okay now?
Okay.
Okay. No bleeding. I find no major bleeding. Or, if you do find major bleeding, what do you got to say? I have major bleeding, and then you'll do your treatment. And I'll teach you that in a little bit. So for right now, you're not going to have any major bleeding. Just you're going through the steps.
So when you do the patient assessment and you're feeling like you did and you're looking at your hands, will the moulage actually have blood on your hands?
Yes, you will actually have moulage patients that actually do have blood.
Right.
Absolutely. Okay? For in this classroom, yes, you're going to put the oxygen on. Just get it on and then take it off and lay it next to them and turn the tank off. So that way we're not wasting the oxygen. Okay, but I do actually want you placing oxygen. That's why you guys all have non-rebreathers and nasal cannulas. The next thing, my patient's skin appears to be normal, warm, and dry. So that's my airway, my breathing, my circulation. What's next? Yeah. I actually want you to place it on her. My patient is unconscious, unresponsive. She is a load and go priority patient. Remember, you have to make that decision. Is she load and go or is she stay and play? All of your patients are what? trauma patients. All your traumas are what? Load and go. Okay? All right, you can take her off. And this is what I want you doing. Put them on it, and then take it off and just turn that off. The next thing I need to do is that rapid trauma assessment. Remember the thing that you guys were getting all kind of confused? This is still part of the primary assessment. So what am I looking for, Cheyenne? What's that thing? DCAT BTLS? What is that?
Like laceration,
Go in order.
deformities,
Duncan, what is it?
Deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling.
Okay? Gotta know that. So I'm assessing my patient for deformities, contusions, abrasions, punctures, tenderness, lacerations, burns, and swelling. I'm looking at her head. Do I find anything in the head? I'm feeling the back of her neck. For step off, do I have any step off? This is what you need to be doing. Okay? Now that I've assessed the back of her neck, can you please get a C-collar on my patient? I'm looking at the neck. I'm looking for tracheal deviation and JVD. I do not see any tracheal deviation or JVD at this time. I'm now assessing the chest. I'm going to palpate my patient's chest. I'm looking for decrepitous. Chest appears to be stable. I'm listening to breath sounds. Breath sounds are clear and equal bilaterally. I am now assessing my patient's abdomen. I will palpate in 4 quadrants while watching the patient's face. That's okay. Abdomen is soft and non-tender. I am now assessing the pelvis. The heel of your hand, okay? You will find the iliac crest. You will push down on it first, then you wrap your hands around like this and you push in, okay? So push down, push in. My pelvis is stable. I'm going to assess the genital region as needed. I'm now assessing the legs. Do I find any deformities, contusions, abrasions, punctures, tenderness, lacerations, or swelling? I'm now going to assess my pedal pulses. Pedal pulses are present, strong, and regular. Can you wiggle your toes? Can you feel me touching you? I get no response. I'm now assessing my patient's arms. I'm looking for deformities, contusions, abrasions, punctures, lacerations, tenderness, and swelling. I do not find any. I'm now assessing my patient's pulse. Pulses are present, strong, equal. Can you wiggle your fingers? Can you feel me touching you? Can you squeeze my finger? No response. My patient remains unconscious and unresponsive. I now need to log roll my patient. Can you please get the backboard so we can log roll my patient onto the backboard? Okay, yeah, I need your help. Nope, C-spine's taken. I need your help log rolling. All right, to log roll a person, okay? Make sure the legs are kind of close together. One hand under the shoulder. Oh yeah, move her arm up. Remember, when we roll, put the arm over the head, okay? Which side am I rolling to? Bad side or good side?
Bad side.
Bad side unless
It's airway.
unless it's a lung issue. Okay? All right? All right. One under the shoulder, one under
Well, that's
just
good side.
at the top of the thigh. The
Good
other
side on
person is going to get the waist here and get the leg. On heads count, we will roll to us. 1, 2, 3. I'm now going to assess my patient's back. I'm going to come down the spine. I do not feel any deformities in the spine. The back looks clear. I'm going to assess down the back of the legs. Do I find any injuries? And they'll tell you yes or no. Okay, I'm now going to roll my patient back onto the backboard. We've practiced this before, so you guys should know how to do this. All right, on your count.
1, 2, 3.
Okay, we now need to move the patient up and then down. Okay, on your count.
1, 2, 3.